I'm gonna pin Karine because she's going to be doing the chatting. Okay, is that can everyone see Karine as the main screen now? Is that okay?
Yes.
Yeah.
And if you could maybe keep your cameras on mute during the first part of it, just because we get a bit of background noise and it can be distracting for other people. So if you can get muted whilst listening, that would be really helpful. Thank you very much. Over to Karine.
Thanks, Charlotte. Hi, good evening, everyone. So my name's Karine Sutherland, and I am the project sponsor for the curriculum framework for children and young people with vision impairment. I'm formerly the head of education at RNIB, which is how I became involved in this project and got this started. And I've continued, even though I've left RNIB, they've kept me on to continue the work and promotion of the framework. So by trade, I am a qualified teacher of vision impairment, a QTVI, and also a QT-MSI, a qualified teacher of multisensory impairment. And my current role, just for information, is I do a large amount of consultancy on the framework, and I work for NatSIP as chair, which is the National Sensory Impairment Partnership, working with the Department for Education, representing vision impairment, multisensory impairment, and deafness to the Department for Education so that they don't forget that our children exist. And then my main job, because that doesn't seem like quite enough, is that I am training teachers in the master's program to become teachers of deaf blindness at Seashell Trust. But I'm here tonight to talk about the curriculum framework for children and young people with vision impairment. It wouldn't be part of the sector if we didn't change it to an acronym. So we call it the CFVI, the Curriculum for Children and Young People with Vision Impairment. So that's what I'm going to talk to you about this evening. I'm going to get rid of my large face on your screen and share you a PowerPoint. I very much hope that is working.
Yeah, I can see that. Great.
Yeah, brilliant. Okay, so this evening, the plan is that I'm going to talk through, apologies, how the curriculum framework came to be, what on earth it is, what does that mean, what are the aims of the framework, and what actually is the framework. So I'm going to talk about a bit about the background, and then actually what is it, and then crucially talk through some of the resources that exist which support it and which are relevant to you as a parent, family, and carer, and then look at and start to talk about how it might be supportive for you and your child as you move through education. So the first thing is how this framework came into being. So the framework came about because it came about as a research paper, which was written by some professionals, specialists in the field, who clearly identified in one paper, summarized a lot of what unfortunately you probably know and have experienced, which is that there are difficulties within education, accessing education, if you have a vision impairment. Not intentionally by any stretch, but there are barriers and there are challenges. And this paper clearly identified that despite it being 2020, these barriers continue to exist and children with vision impairment are being disadvantaged because of them. There is some significant legislation which underpins much of that, the Equality Act from 2010, which dictates that everybody should have equitable access. And this paper identified that this wasn't happening consistently for all children with vision impairment. The wider political context at the time, and remains so, is that national education policy and funding was being devolved to schools and local authorities and stretched. Children with vision impairment numbers were going up, and resourcing in terms of funds was remaining the same, or worse, being cut. meaning that there was less resource, less money to go around. So there was a pull on time, not to the benefit of those children. You will know full well that our education system is a testing education system in many ways, but I'm referring to tests and exams, and we are geared towards a results-focused curriculum and education system. That is how schools are measured, that is how young people are measured, and it drives towards that. And if you take into account the barriers and the challenges that many children with vision impairment are experiencing, it makes it even harder to succeed in that system. And this paper also identified that there was a lack of shared language, shared understanding about what children need. So a parent could very clearly articulate what their child needed, but how they said that might be very different to how a parent in a different part of the UK might explain it. Not for any particular reason other than there's just those inconsistencies. So this paper clearly identified the need for some cohesive framework that would identify what a child with vision impairment needs or may need throughout their education career in order to access the national curriculum or equivalent. So this isn't about the actual English, maths, and science. This is about the skills needed for a child with vision impairment to access the mainstream curriculum. And that's for all children from 0 to 25 in any education setting. So mainstream and special schools. It sets out a range of skill areas that a child with vision impairment may need to have support in. The big push behind this paper and the framework launch was knowing that our colleagues around the globe are way ahead of us. There is the expanded core curriculum in North America, a different version in Canada, but very similar, where it clearly identifies what children with vision impairment will need, and it's part of the inbuilt structure. The same in continental Europe with similar structures, and the UK was behind with that. So there was a big push to get this established, and we managed with a group of organisations to produce the curriculum framework, which you can see on your screen now. So the four driving organisations at the beginning were RNIB, the University of Birmingham, Thomas Pocklington Trust, and VIEW, which is the Vision Impairment Education Workforce, which represents the professionals. So that was the framework launched in March 2022. So we're 2 years past the launch now. But what are the aims of the framework? So the framework has 3 main aims. One is that it clearly defines and clarifies the specialist skill areas and interventions that a child with vision impairment might need. I'm going to come back to that in a little bit, but it's not saying that all children with vision impairment will need all of these skills sequentially or all the time. It's saying these are the skills that a child with vision impairment may need support and interventions with. And the framework clearly identifies those. It's there in point 2 to assist specialists to raise the awareness of those needs, because as you will well know, vision impairment is a low incidence disability. We talk about there are not many children with vision impairment in the UK in terms of other areas of special educational needs and disabilities. There are identified about 44,000 across the UK, which relative to other numbers is quite low. So this framework, the other aim was to help professionals such as QTVIs and HAB specialists talk about children and enable people to understand. And then the third aim is to aid discussions and that understanding from not just specialists, but also non-specialists. and crucially with families. And I think I would put families in the specialists category, because you know your child best and what they need. And this framework is there to identify all of those and aid that understanding in the sector and wider about the needs of children and young people with vision impairment. What underpins the framework, it was developed through a consultation method with the University of Birmingham over 18 months with stakeholders across the UK, so with families, children themselves, education professionals, health and social care professionals. And underpinning it is striving towards positive outcomes for children and young people, and the model about access to learning and learning to access. This is a little bit jargony, so bear with me, because I think it's helpful to understand this balance that, to start with, a child enters school and with a vision impairment and may need lots of support to enable them to access learning. And by learning, I mean mainstream learning or special school curriculum. They may need a one-to-one support. They may need lots of strategies and support given to them with another adult. But over time, we would really hope that that adult support lessens as the child is able to be more and more independent and take agency themselves. And that is where the shift from access to learning to access comes. And that model underpins the framework. So no matter what your school setting your child is in, what their abilities are, this model applies, that we would always be working and striving to get the most positive, independent outcomes for your child. How are those outcomes decided? They should be decided as a group of people who are there together. So if your child is able to take part in that, then they should be part of it. You should be part of that, your QTVI, the school, other people who are invested in that should be part of that discussion, ensuring that those outcomes are matching with that. And this is just a visual of that access to learning, learning to access. And this is why you may hear schools or QTVIs saying, we don't think your child should have a one-to-one full time. We would like them to have, so they are probably thinking along these lines of eventually working towards optimum independence and outcomes for your child. And of course, we recognize that for each child, that's incredibly different. So that is the background and what underpins the framework. What on earth does the actual framework look like? So the actual framework is the child at the center and 11 specialist areas around that child. Now, these areas are numbered, but there is no expectation that you would move through these one by one or in order for that matter. They are there to identify the key areas that you may or may not need access to for your child in order to they access the main curriculum of the school at some point during their education career. They're given a title so that we can all talk about them with the same language, so we all know what we're talking about. So sensory development incorporates, for example, some children at special schools, that would be developing their use of touch and residual vision and other senses. For children in mainstream, that might be about listening skills. It may be about developing Braille skills. It depends. There's a spectrum, obviously, of need within each of these areas. But these are the key areas that anybody might need. And you'll notice that the framework also covers outside of school. So it's not just education in the classroom, but also out of school activities, after school clubs, and getting ready for adulthood and transitioning into whatever comes next for them. The one area that perhaps I draw your attention to, which we've had quite a lot of feedback about, is Area 1, which is facilitating an inclusive world. And it's felt very much that that's a much bigger sort of umbrella area, which is a bigger piece of awareness, enabling schools to have a positive approach to people with disabilities, society to have an understanding of what vision impairment is, what people might need. And obviously that's a much, much bigger area than just your child and your school necessarily. But it sits within the framework because it's a fundamental part of raising that awareness. This is just a quick example of a student of mine who's called Sam, who actually, this is a special school example, who is in special school, is in a wheelchair with a severe vision impairment and some learning needs and some additional medical needs. And at the time that the assessment was done, we had a meeting and discussed what his key areas of need were. And we kept Area 1 because that's the overarching facilitating an inclusive world. Because of that, we wanted really to develop his sense of touch and have a program for that. So we were looking at his skill development within sensory development. His communication was linked to touch, and we were working on using a series of switches. So we were combining that, which led into his literacy skills, accessing literacy, so the switches were also applicable for literacy. He also had input from a habilitation specialist on using his wheelchair, which was self-propelling. He was starting to learn how to do that. So we had a whole program there. And then he was big into his sport. So we were looking at how we could support his access to sport, both in school, but also in the after school clubs. So you'll see that at any one time, it's possible that many areas of the framework are being looked at and worked in, but that some areas aren't. And that potentially, once he's got access to some of the sports club, maybe 10 would be unhighlighted and wouldn't be a key focus. But it might come back in later as he changes. And that's the same with any of those areas. It doesn't need to look like this, but for the purposes of this presentation, I thought it was helpful just to show that it's possible to have multiple areas at any one time, fading in and out depending on your child's needs. Whilst the framework was developed for everybody, we were very aware that predominantly professionals were using it, and we don't want it to just be a professionals document. We want it for everybody who's involved with children with vision impairment, and parents and carers and families are a key part of that. So a group of parents got together with support from those 4 organizations and wrote a guide for parents and carers around the curriculum framework, how it might be useful. It doesn't have anything different in it to the professionals version as such, but it frames it from a case study point of view, how I've used it, tries to strip away some of the acronyms, which we all fall into. We try not to, but we do. Tries to break down some of the jargon, and make it really accessible for you. Unfortunately, we don't have any hard copies, but it is available for download on the RNIB website. And it has had a very, very popular response with parents who have had a look at it. They feel it's more accessible than the main document, which was the point, that it was there for parents. So that is there for you if that would be helpful. Also, I wanted to point out that your child may already have access to Bookshare within school and the curriculum. there is a resource hub which sits within Bookshare for the curriculum framework. So largely this is geared towards professionals, but if you're interested and want to see the resource hub on the Bookshare is broken down into each of the 11 areas of the framework and has associated resources and websites and materials. So it may be helpful for you or of interest to look at what kinds of things on there. It's by no means a complete list of what's out there, but it's a start to support professionals from having to reinvent the wheel, and to support them when they're looking for areas and work in any of those skill development sections. So those are two key resources that I would signpost you to. So as I say, the framework launched in March 22, and since then we've been doing phase 2, which is the implementation and embedding of the framework. So our ultimate dream is that the framework is statutory and exists in the Code of Practice as part of statutory requirements for a child with vision impairment. They should have access to everything that's within the framework. But that process is not straightforward to become statutory, especially when you've got a general election on Thursday. But it is something that we are working towards. And in the meantime, there is lots of work going on to support the work of the framework. So this phase 2 finishes in September 2025. And we have been doing over the last 2 years and 1 more year to go, a huge range of specialist training and awareness. So for specialists, for QTVI, so that they're comfortable, familiar, know the framework inside out, and are able to take it into schools and embed it into some of their paperwork. We're working really hard with the governments around the UK, all 4 of them, to get it into policy, guidance, documents, anything like that, which is working towards it becoming statutory. So we're working hard with third sector organisations on the policy and influencing. As part of that, we released policy position statements for each of the nations around the UK and a UK-wide campaign report, which talks about why the framework's essential. If you are into local politics and you work with your local MP, the campaign report and the policy position statements are a really good way of flagging why the framework's needed and what children with vision impairment need to access education. I think most people just don't think about it because it's not relevant to them. So they have no concept of how many things somebody might need in order to access the national curriculum. We're also evaluating the framework. So we're doing a survey and interviews with a range of families and professionals and young people across the UK to see how this has changed provision and outcomes for them in the 3 years, it will be by the time we finished, that they've had the framework. And then depending on that feedback, we may revise or review the actual framework if we get feedback that that's needed. And finally, the 4th area that we were working on is resources to support the framework. So the parent guide was one of those, resources in the resource hub to make things accessible. And this year there's coming out a young people's guide. So they are going to work together to tell us how they think the framework should be used and how it could help them. So that's a really whistle-stop tour of the framework. I'm going to attempt, if technology will behave, to share with you a soundbite from a parent. I don't know if the parent...
Yeah, well, I've got my son.
Sorry. I don't know if the parents might be on the call, but this is a parent who talked about how they have used the framework with their child. So hopefully, Pedro, I can actually see you on camera. So if you can hear this, can you put your thumb up? So this is the bit, the soundbite.
Yeah, well, I've got my son's education and healthcare plan coming up. Yeah, well, I've got my son.
Did you hear that?
Yeah. Yes.
Yes?
Yes.
Okay. Oh, sorry, apologies.
Yeah, well, I've got my son's education and healthcare plan coming up this next month. So what I'm trying to do is use the curriculum framework to help structure the meeting. And so what I found is that it does actually give you structure and pathways to follow when negotiating your son's support or your child's support. I mean, most importantly for me was the area of facilitating an inclusive world, because when I learned about the social model, which was a while ago now, it was a real sort of light bulb moment, and really it helps really fit the narrative of what you're trying to achieve on an education and healthcare plan. No longer are you focusing on trying to fit your child to the school. You're realising, and the curriculum framework gives you that empowerment to actually say, no, the school can adapt to my son's needs. So I think the most important thing is getting everybody on board with the area one, the inclusive world. And as soon as you've got that, then I think what the curriculum frameworks helped me is to follow then the 10 pathways to help structure the meeting and give you some focus. That's how I'm planning to use it.
A really nice summary of how that parent was using the framework and helping manage some of those really unwieldy meetings that you get called to and asked to talk about. So I'm going to stop talking there. I'm just going to leave this slide up for a minute, although I will put the details in the chat and Charlotte can circulate it.
Yeah.
If you have any specific questions that we don't cover tonight or you want to ask, if you email cypf@rnib.org.uk with CFVI in the subject heading, then we can pick up those emails on an individual basis. They'll come through to me and the project team. But we have got some time now, I believe, and Charlotte's going to feed me some questions,
Yes.
I think. I'm going to just stop sharing my screen. I hope that was interesting and people know more than when I started 20 minutes ago.
I think we did have a question from Sarah, and she's obviously we've just covered this. So, is it worth having the CFVI reference in a child's EHCP?
Yes, and absolutely. And there are a number of local authorities now which are embedding the framework into their EHCPs. So they will be referencing the different areas of the education healthcare plan into the outcomes and needs and areas within an education healthcare plan. In order for that to happen smoothly, my advice would be to speak to your QTVI and say, is it possible for us to use the framework and get that embedded into the EHCP? If you don't have an education healthcare plan, don't worry. The framework is still valid as it is and it gives you, in fact, that structure for those meetings. So if your child's on an individual learning plan or individual development plan, then the framework can be used to structure that input and in fact really supports that because it gives that clear outline of different skills.
Okay, brilliant. I hope that answered your question. And we did have some pre-submitted questions, so I'm just going to visit one of them and then return back to the chat. So who can write the targets and outcomes for the HCP as teachers in non-maintained schools don't know about the framework? And where can I signpost teaching professionals to get some help with this as well?
Yeah, so I really think your QTVI is a key person in this process. So getting your QTVI involved. The RNIB website holds all the resources connected with the framework. So that's a key area to go to get all the resources yourself, to upskill yourself, and then to speak to your QTVI and discuss how you're going to approach that together, would be my advice. It has only been out for 2 years. It is a very specialist area. It's not to us on this call because this is your life and it's my work. But for many people, they will not come across a child with vision impairment in their whole teaching career. And unfortunately, that's something we're having to battle against all the time, is raising that awareness. So it frustratingly does take a long time, but we're trying to get it out there as much as possible.
Brilliant, thank you. Question from Teresa: does the resource hub have a primary school syllabus on there?
Yeah, the resource hub covers 0 to 25, like the framework, so it's not set age groups, so it covers the whole of schooling. And because the framework is for children for all ages, it doesn't differentiate primary and secondary, because for some children you might be developing your sensory skills in secondary school, or you might be developing them in primary school. So it doesn't differentiate. It identifies the skill areas that a child might need, but it doesn't say when or how, because that's so individual to each child. But the resource hub mirrors that and covers all ages and all spectrums of education.
Okay, thank you. Why aren't QTVIs being proactive in sharing and leading on this? Is it a funding issue, do you believe?
When you say that, why aren't QTVIs sharing, leading, I'm guessing what you're saying is they're not talking about it a lot with schools, and with you. And I guess, why is that? It's absolutely not to do with funding as such, because anything to do with the framework is free, because we want it to reach as many people as possible. We want it to impact positively everybody. I think knowledge about it is still growing. Confidence in how to use it is growing. So I think some local authorities, some QTVI services are further ahead with what they're doing. Some have got it embedded into EHCP processes and annual reviews already, and some are just catching up. So different local authorities are at different phases. But now that you can say to your QTVI, I went to a really interesting session about CFVI. Is there any way we can build that in? I think that might be really helpful for your child, and you can bring that in.
Okay, brilliant. I'm glad that answered your question, Philip. Teresa, I'm not quite sure. Teresa, when you've asked, can the curriculum be accessed online, do you mean the primary school syllabus that's embedded within the resource hub? Is that?
Yes. Can you hear me?
Yes.
Yes. Okay. Yes, I do, because my grandson has a lot of trouble with writing, and at the moment that is still part of his work as expected of him, really. But I support him quite a lot, and I find that he works far better if he can he's learned touch typing, if he can do it through digitally. So I think he will become more independent the more digital tools that he can use.
Mm-hmm. And that's exactly the area. So technology skill development on the framework, that's a perfect example, Teresa, of your grandson, I think you said, sorry, needing that specialist input to build those skills, because that's his preferred way of accessing the curriculum. So we really need to talk about the framework as a framework and the curriculum in schools as a curriculum, because this isn't the national curriculum. This isn't a primary school or a secondary school curriculum. This is a framework that identifies those 11 skill areas that what's been called the fried egg diagram. So what was your question? Sorry, so the actual framework is available on the RNIB website to download, yes.
But is the course syllabus available? Can he access? And they do twinkle pages. Can they be accessed?
Oh, the primary school curriculum.
Yes.
That's accessed. That's different. That's accessed through your school systems. That's separate to the framework.
But can they access that primary school curriculum through the RNIB? digitally.
Do you mean, can they get that digitally through Bookshare?
Yeah. Yes.
Okay, Bookshare is for predominantly books and copyright and producers. So it doesn't do curriculums, national curriculums as such, no.
Because that seems to be a gap that exists.
Yeah, it's of the same category as sort of exam revision guides. Where do they sit? And those are done on a bespoke basis. There is another website that has Twinkle digitally.
Is that what?
You're going to ask me what that is. I need to look that up. I will send it to Charlotte. Let me make a note of my.
I'll make sure you get that, Teresa. Yeah, so what she's trying to say is that so the resource hub with the primary school syllabus, it's more of the primary school supporting the syllabus rather than the whole curriculum being on there. Does that make sense? And
yes,
the framework sits alongside it.
What I really need is a program which is interactive, so that the questions he gets asked, they can be sent online and then he can answer them without having to do a paper version.
We're now getting into a bit of a, but does he have a QTVI?
Yeah, but I wouldn't say the input is great.
Okay. Right, I'll send you what I can find out via Charlotte.
Okay, thank you.
We've got another question. This might be slightly off topic as well. Can one-to-one support teachers be trained as VI teachers?
So to be a qualified teacher of vision impairment, you first have to be a qualified teacher with mainstream teaching experience. So, and then you do a 2-year postgraduate course. So if your one-to-one support happens to be a teacher and is chosen to work as a support rather than a teacher, then yes, they could do the training and become a QTVI. They could, if they are a support worker, just do some other training that's specifically for supporting children with vision impairment. And VIEW, which I mentioned at the very beginning, has a range of courses which are suitable for support workers, support assistants.
Yeah.
I hope that answered the question.
Yeah. Can you hear me? Sorry.
Yeah.
My problem is Ramsey, my child will be transitioning next year into secondary school, and he will be placed with a TA, but not as a one-to-one all the time. But it's just, I feel like I'm constantly reminding them what needs to be done with my son and the QIT teacher as well. So I just feel like there's not a lot of understanding with TAs that know about VI. So he'll spend maybe the first few months them understanding it, but still not getting it right.
Yeah. And I think unfortunately, that's not the first time I've heard that, which is zero comfort to you at all. But I think some of that could be addressed if the school put some of their TAs on some of the vision impairment training, or the school have some vision impairment training themselves. Often that should be done by the QTVI, the VI service locally, or the third sector organisations, RNIB, Guide Dogs, VICTA, Look. Some of those organisations will offer those things.
It's just a shame. It's only because the VI teachers only come in as and when needed. They're not always there to see the struggles that my son goes through. Now they're saying, "Oh, keep them in mainstream school because it's easier because they've got the funding." He's got his EHCP, and they need to follow that, but still they can't seem to get it right.
Yes.
Yeah. That's where.
No, I understand. The other key person in that scenario, especially once you hit secondary school, is your SENCO. And seeing what you can get them to do in terms of raising awareness across the staff and amongst the TAs. But I absolutely hear you. It is not an easy task, and it doesn't happen overnight. Like, sorry, that's not a very cheery message for a
No,
Tuesday.
it's okay. Maybe it's just me being anxious because he's going to be going. It's going to be such a big transition
Of course
from
it is.
primary to secondary school. It's just I want things implemented, and
Yeah,
I know it's going to be a bit of a struggle to begin with, and it's going to be a bit of a fight. But hopefully we'll get there with the support.
yeah, absolutely. Yeah.
Thank you.
Okay.
Well, just a question. It's a little bit off topic from the framework. But due to the shortage of QTVIs, are they looking at changing the criteria of qualifications and experience? You might know a little bit more about that.
Yeah, there is no plan to change criteria, qualifications, or experience. There is going to be some additional training routes in, so that there are more training places available for people wanting to train to be QTVIs. And again, the third sector organisations are doing a lot to promote that there's even that role. I think a lot of mainstream teachers don't even know that it exists, don't even know it's a thing. So there's a big piece of work we need to do around raising awareness and getting the message out there that we need these teachers. But to become the QTVI, you have to be the QT, which is the qualified teacher part. You can actually do the VI 2-year postgraduate course as a non-teacher, but you are not then a qualified teacher of vision impairment. You are just, not just, but you are somebody who's done a postgraduate in vision impairment. It's a, I don't even know what it is, a postgraduate diploma, I think that's what it is. If you don't do, and you don't do the teaching placement, obviously, because you're not a teacher. And then because of the way the system is structured, you can't then hold a post because you're not a teacher. So we've rammed ourselves into a corner a little bit. But we are expanding the number of routes and ways to train to try and get more people into the sector. I go around telling everybody it's a fantastic job. I hope that helps. But it's a lot of work to be done. Sorry, Sarah.
I think we're all getting a little bit of a vibe here that we're all struggling with our QTVIs and accessing them.
I know. This is very sad. I'm really sorry to hear that.
I think I'd like to just say it's kind of my experience of it. I thought that this QTVI that I'd read about on the internet would be sat with my child at all times, and they'd be the one that would be teaching them. And I didn't actually realise how little input was actually given to the non-VI trained teachers in terms of. So it's not a new thing for any of the parents here that have got younger children. I'm sorry, that's not a very cheery message either. But I just wanted to share my personal experience as a. Oh, and Heather, have you got your hand up?
Yeah, sorry, negative experiences. I've got 2 severely visually impaired boys. What I was going to ask Karine though is it's such the document, the framework's a beautiful, idealistic piece of academic literature. It's wonderful. I've read it and I think it's so it really does think about a blind child and a visually impaired child and all the things they need. But at the moment, as parents, we're living in postcode lotteries. Some of us have got QTVIs. I've had experience of amazing QTVIs. I've not got any in my region at the moment that are trained. We've not got assistive technology. Everybody's experience is so different. Will the framework, if we get it legislated, because I know you were talking about that next step, will that give us some standardization for blind and visually impaired students? Because at the moment, it's a lottery where you live. It's a lottery how many and what the caseloads like QTVIs and other professionals come in and do mobility and rehabilitation, but with no standardization. And I know we keep going back to the Equality Act and disability discrimination, but we're all just in a queue. And all those parents are doing everything. We're all on the front line, and I know you're a massive campaigner, and thank you for you and your team. But if we get it legislated, does that mean we've got some standards where we can go, actually, this framework means this, and this has to stop, and this is good enough, and we can advocate with some some vigor. Does that make sense?
It
For the
does
parents?
absolutely make sense, and I really feel for you, and I totally hear what you're saying. I'm really sorry for where you are at the moment. That is less than ideal, to say the least. And the framework was absolutely done to address just that, those inconsistencies. There's another comment or question in the chat about how different paperwork is from local authority to local authority. Well, we want this framework to be consistent. That's why we want everybody to adopt it, why we want it to be legislated and statutory, so that then everybody can say, look, I have this child, this is statutory, this is best practice, this is what my child is entitled to. And at the moment they need HAB, they need this, which is all outlined in the framework. But obviously that is a long process. The general election, I'm not making excuses, but that's delayed things in any way of that, because we now need to see who's coming into government and what their agenda is going to be with SEND. And we're up against it because SEND isn't popular, isn't talked about in politics very widely. And then within that, vision impairment is a small section of that. But that is absolutely what we want the framework to address. And part of that success will be you on the call, taking the framework, the parent guide, having a read of it and speaking to your QTVI or speaking to your SENCO saying, look, this document exists. It's best practice if we use some of this. How can we build this into the processes? And doing it on an individual basis and starting from the ground up. If it's not yet legislated and coming down that way, then let's start it from the ground up. That is how it will move forward, but it won't happen overnight. I wish it could. I wish I had more power to do more and quicker, because I absolutely hear you, and I hear stories like that, Heather, far too often. But that is exactly the purpose of the framework in a nutshell.
No, thank you. And we will, as parents, I think, and carers, if we know how to advocate for it, we will, because at least we've got something now to go, that's how it should be. And as I say, I think I think it really does encapsulate everything that my two boys and other blind VI kids I know, and carers, and how exhausted we all are. We're all warriors at the moment, but the framework's wonderful. But I'm just thinking, how can we really get some standardization? So it shouldn't be a postcode lottery. It should be wherever our children and these young people are, they should be having some standards, because it's just, you speak to parents and carers and it's just, honestly, it's horrendous. It really is. Yeah. It is. So thank you for what you're doing though. Thank you.
Thanks, Heather.
Okay, yeah, so we've touched on that, on the different counties. Oh, no, we've got another one here about, do you have a timeline for this raising awareness training in the settings? It's
happening now, it's being rolled out, we're doing it, obviously not over summer holidays, but it's going on all the time. And next year we're looking at we've been working with specialists, so that QTVIs and habilitation specialists know more about the framework and are confident in taking it out there. The next bit, we want to get into mainstream and special schools, generic special schools, and talk about it more. But you can appreciate that many mainstreams will never see a child with vision impairment. So it's quite difficult to reach the right mainstreams and the ones so that it takes effect. It's a very challenging way of working. So we're working with SENCOs, those people who are more likely to meet them. It's just, all I can say is it's happening now. The timeline is now, but it's just slow. And I can't, I'm sorry. I wish it was quicker.
brilliant, thanks for that. We've done all the pre-submitted questions. We've got a couple of minutes left, so if it's a short question, get it in there. If not,
Philip's question, he did ask about the framework.
Oh, I'm sorry, did I miss? Oh yeah, sorry. How far is the framework placed to help create a bespoke EHP framework for QTVI?
Yeah, so I think the framework's really well positioned if you've got a good SEN officer or QTVI or Senko, so that you can talk about, well, this is the framework, this is identified as best practice for a child with vision impairment, and that's my son or daughter, and I would like this incorporated into the education healthcare plan. Can we look at how that does it? If you look at your education healthcare plan and the framework, you will see that some of those specialist areas really easily map across onto different outcome areas for your child. So you could just say, well, can we name this area 1, area 3 of the framework? Can we then link the outcomes to area and start to embed it? Use the language yourself. That's why I wanted to come and do this session, why I've done another session last week and I'm doing another one, because I want parents to be able and confident to say, okay, well, can we use the framework? I know a bit about it. I think it could go, you know, here, there, or at least open that conversation. So you know enough about it to do that. Check out the parent guide, because I do think that makes it feel hopefully slightly less daunting and enables you to take it into schools and have those conversations. I'm saying talk to your QTVI, but I am hearing what you're saying about QTVI. So I'm sorry if that's not a helpful message.
Can I just say in their defence a little bit that they're so stretched.
Exactly. Well, I'm a QTVI. I do a lot of work myself. So
yeah.
I feel very torn, because I hear what you were saying, but they are incredibly stretched. They have caseloads going up and they're doing more and more. It's a really tricky, and that comes back to funding, doesn't it, from central government.
And even the teaching staff are so stretched as well. I mean, I've suggested that they go online and do the RNIB course, but nobody wants to.
Yeah. Yeah. There is one question in the chat from Claire. Claire, I wish I could answer that, but it depends on so many factors. How often your child should be seen by a QTVI in a year. There is a framework for that, a professional standards framework that should help calculate, that makes it sound a bit cold, but enable your QTVI to gauge what the levels of input should be. But it's done on an individual basis, the child's needs, the setting, the family, a whole load of factors. So I couldn't begin to say what that is on average, I'm afraid. Sorry, not because I'm trying to avoid the question, but just because it's quite broad.
We've got, we've something similar just about, I know this is a little bit off the framework again, but is there anything in the framework that will address the fact that the child's school holiday club won't take the child for that club because there isn't the funding for one-to-one? Is there anything in there, or does it not cover background care?
Well, it doesn't cover the funding issue, but it does cover the issue that a child's education is not just 9 till 3. A child's education is all of that, and one of those key areas is sport, leisure, activities, which I think so closely links with emotional and physical health and well-being, because if you don't have access to those things, you can't do things with your friends. All of those things are affected. So the framework does stress the importance of the skill development around that, but it does not help with funding as such, and that's a whole other dare I say, can of worms, kettle of fish, something like that.
Thank you for that.
Can we finish on a good news thing, please? I'm feeling sad. I feel like I've just depressed you all for a Tuesday evening.
I think it's just we're all kind of joined in the fact that we're frustrated with
yes, absolutely.
the input and the support. I mean, we want our children.
I know.
You know,
but you've given us an anchor.
That's a really nice comment. You've given an anchor, which is good.
Thank you, whoever said that. Thank you very much. That is, and it is an anchor, and it is you know about it now. I mean, I suspect many of you knew about it anyway coming into it, but hopefully you know enough. You feel like, okay, I'm going to read the parent guide. I'm going to take it and talk to my QTVI. If you haven't got a QTVI, I'm going to talk to my Senko and say, look, this is what my child needs. How can we get this together? you know, I really want to be able to work through these areas and make sure he's accessing the national curriculum. So it is a good anchor, and we're doing all we can behind the scenes with the wider picture.
Thank you.
We've had a comment from Sarah. I think, is this for you, Sarah? Sarah, I'm assuming. Just been advised my son is eligible for 2 hours per week, extracurricular activities through Achieving for Children. Is that a scheme that I've never come across that before. Do you know anything about Achieving for Children, Corinne?
That sounds like a local authority that are called that, but I don't know if that's a local funding stream. I'm not familiar.
I'm in Richmond Borough, and basically it came up with because my son starts school in September, and one of the things that the school said was, you know, you need to sort of consider with regards to the EHCP about extracurricular activities. So I posted on a parents forum, you know, the RNIB forum. I spoke to a local charity here called Skylarks, and basically they put me in touch with an inclusivity officer at the council, and they've come back to say that he's eligible for 2 hours per week at £15 per session, so that he can have a one-to-one. And also they've got also holiday clubs as well, so I'm going to actually have a meeting with them tomorrow. So I suppose it's just finding out what the language is like when speaking to your local authority. I didn't realise that we had these inclusivity officers, so it's worth asking, you know, the questions basically.
Yes, exactly. And Achieving for Children is obviously what they're called in Richmond, but they're called unhelpfully, they're called something different everywhere probably. So, but maybe inclusivity officer, short breaks is the other. Say again, Charlotte?
Yeah, I was going to say short breaks, and I was going to say the holiday clubs that my daughter receives is by direct payments. I don't know if you
yeah, that's another route sometimes, isn't it? And this is what Heather was talking about, which is this postcode lottery. Everything's different in different places. That doesn't make it any easier for any of you all to navigate and find what's available in your area. But Facebook groups and those kind of things are good for parents who might have already gone there ahead of you.
Brilliant, thank you. Okay, let's check the time. Have we kept it 5 minutes over? We've done very well tonight. Sometimes I'm having to kick parents off. So I just want to say a huge thank you to Corinne for coming and presenting that tonight. It's very informative. I received it, the professionals version, through my charity, and thought, you know what, more parents should know about this, because we are the ones that get in the teachers' ears and are advocating for our children. So I hope you found it beneficial. I hope you can apply ways it can work with the curriculum. I hope it making you feel that you've got some points in EHCP fights that you can refer to. Oh, sorry, we just had another one.
That's all right. I'm just replying offline.
Oh, okay, perfect. Okay, yeah, that's fine. Brilliant. But yeah, beyond that, it's been really nice having you all here tonight, and ask. Well done, Corinne, for answering some very difficult questions. It is hard. We know you're frustrated. And if you do have any suggestions that you want to make directly to VICTA in terms of workshops or gaps in areas of learning or professionals you'd like us to bring to the table, perhaps not a lot of QTVIs, we might not do that one, but if you have any suggestions about something that you feel uninformed about, then please just come to me at any time. I've been doing this program for a long time now, so I'm running out of ideas. So any suggestions wonderful parents can make are much appreciated.
Thanks, everybody. Lovely to meet you.
Thank you very much.
Thank you.
Thank you. Thank you very much.
Thanks for that, Tom. Appreciate that.
Thanks very much, Charlotte.
Thank you.
Thanks, Philip. Bye.
Bye.
Thank you from Teresa. Bye now.
Bye.
Oh, I'll stop recording.
Thank you.
Thanks, Heather.
Thanks, Heather.
Take care. Bye-bye. Thanks for all you're doing.
Thank you.